like to welcome Dr. Fedor Lurie, who has really been one of the stars in the firmament of venous science. He's presently the Associate Director at the Jobs Vascular Institute, and he's been there since 2016. He is also the Chair of Science for the International Union of Phobology. He's internationally renowned for really looking at some of the basic pathophysiology involved with venous disease and really trying to help us better understand venous pathology. He's a former president from the American Venous Forum and really been a stalwart for better understanding venous disease. Thank you very much for agreeing to do this podcast.
Well, thank you very much for a very kind introduction. I'm happy to address any questions that you have.
So we're going to be talking a little bit about a recent article that you and your group have in the JVS Venous and Lymphatic looking at accreditation. Can you tell us a little bit about why you wanted to look at this?
Well, thank you for this question. It's very interesting because we have a number of accrediting agencies in the country, Joint Commission that accredited the hospital, and sometimes it's quite cumbersome process to comply with those standards. But those standards are mostly technical, so they're looking for, how many rooms do you have, what the size, what the tech. So it's always a question, does it really translate into any patient care, really, the patient outcomes? And so we're looking for that from the venous point of view, and we have IAC, Intersocietal Accreditation Commission, that has their standards and voluntarily process for accreditation. And we also have a couple of venous registries. Of course, VQI is the very good one and the best probably choice, but also because VQI is mostly focused on in-hospital practices, not so much for outpatient practices. There also AVLS registry that has more outpatient. So we have two sources that we can look and see if that accreditation process actually translates in something that relates to the outcomes and the patient care. So that was an opportunity that came up, and we wanted to use that. That was the reason for this paper.
And how did you break up your two groups? Can you explain about how you identified your
Right.
groups one and two?
That is I think it's a most important question for this study, because when we look at this, and we definitely look first on the centers that were accredited, not just once, but several times. And it turns out that some of the centers, even during the first application for accreditation, actually checks all the boxes. And there were other that when they initially applied for accreditation, they have some issues, whether on application process or during the site visit when they check, and then they fix them and get accredited. So the question was, okay, you have two distinctly different groups of centers. One of that's already do everything that's required by minimum standards, so they probably unlikely to change anything as a result of the accreditation. However, the real question is the second group, whether this process of getting them into compliance with the standard changes the practice. So we really need to compare those. So that we separate those, stratified in two different groups. So group one, initially compliant, and group two that initially was not, but then, of course, they became compliant because they get accredited. And they look through the 2 or 3 cycles of reaccreditation to see whether they maintain those practices.
And what were some of those changes that you observed specifically? Because they were actually quite interesting.
Right. Well, and I will start answering this question with the baseline, because when we look at all the centers, not only those that included in this two group, but all centers that are accredited by IC, we found that initial status of the centers was not quite good. I mean, we had major issues with the safety, with the procedural requirements, sterile stuff, outdated drugs, and all kind of things. So which were alarming. So from that point of view, we definitely saw the significant improvement during accreditation, and that improvement continued through the reaccreditation cycles. What was interesting is to look at other patient population. It turns out that those centers that were included in group two that were initially compliant had a different population of patients. They were younger, less severe disease. At the same time, they did more procedures per patient compared to the first group, but the outcomes in terms of the change of severity of the disease were either similar or even not as good as in the group one. So then what happened, and we cannot really state that that was a cause and effect of accreditation process. It's more something that happened during this accreditation process and post initial accreditation. That's group two became very much like group one. So their population of patients for some reason changed, shifting to more severe disease, more older patients, advanced disease patients. The number of procedures per patient decreased, but their outcome improved, which indirectly indicates that some of these procedures probably was not very well justified to begin with, and especially in the population with the more severe disease, they were able to get better clinical outcomes by performing less procedures per patient.
So these are important findings, and I want to focus a little bit about some of the baseline demographics with the failure to be accredited. You said there were some really surprising deficiencies in some programs. I was really surprised to find that one quarter of the RVTs, one quarter of the vascular technologists were not certified as RVTs. I thought that was surprising, I guess, because don't, we assumed that all of them would be accredited before or certified before accreditation of the site. And some of the safety problems were quite striking.
Uh, yeah, I cannot agree more with this. It was really surprising. I think the importance of this finding is to look at what the real happening in the world, in our backyards, and we are talking about a selected group of centers that were seeking accreditation. So it's not necessarily the reflection of all the practices in the United States, but it would be, I think, reasonable to suggest that at least some of those centers who are seeking accreditation were thinking of themselves as the very good practices. And so they look for approval of their quality. So that was surprising to find out that safety issues were present in such a high percentage of patients. Now, I can give you the anecdotal findings that IAC staff reported in their database, and that was very eye-opening. That a few instances, for example, the autoclave that used for sterilization were put in the bathroom of the patient. The lidocaine that was used for tumescent was 1 year post expiration day. That kind of findings are really alarming, and I think for the accreditation credibility, that's important that those that were eliminated immediately. I mean, that was finding pointed out, and of course, any reasonable practitioner recognized that that was something that shouldn't happen.
Well, in conclusion, I just wanted to sort of talk about what the takeaways are from this about accreditation and the accreditation process in terms of quality and safety. Can you just sort of bring it all together so that practitioners who may be considering um, accreditation for their venous outpatient lab, what they should look for, because it takes a fair amount of effort, time, and money to actually put it together. What are some of the benefits?
Yeah, I think that what the study suggests is that accreditation process translates not only in the better procedural or technical aspects of the practice, but also translates into the better outcomes of the patient's outcomes. I think that what the study suggests that accreditation process helps the practitioner to put his practice or her practice in the system. So you have written standards, and when you know that you comply with the standards, you're addressing the key elements of the routine practice. So they're not really chaotic and very standard, and they're the same as other skin centers which are accredited. So it it makes sense to me personally that accreditation translates in some positive things, but it is in a way it's the first time that we were able to confirm that there are some changes in patients' outcome associated with the accreditation process, not necessarily caused by, but something during accreditation happens that translates in the patient outcome, and that's a good finding.
For us, I think the accreditation process in of itself of making certain that you have all of the protocols, all of the safety, um, all of the quality projects and quality improvement projects, et cetera, making certain that all of your I's are dotted and your T's are crossed. That process
Yep.
by itself helped us bring together a lot of pieces that we had in different silos and bringing it all together. For us, that was really important. So I think this is an important paper. I think it helps not only highlight the quality of the accreditation process, the quality associated with going through the accreditation process, but here in New York City, it's not only just for you to prove to yourself that you have a quality program, it helps in a competitive edge. We have three vascular offices within 2 blocks of us, within 200 feet of our office. And yes, if you have accreditation, patients notice and others notice, referral patterns change. So I think it's not just, I don't think it's just proving it to yourself, it's also proving it to others. And patients and referral patterns do change.
Well, thank you. I completely agree with what you said. I think it's also important to know, for the patients to know that if you're accredited, you follow certain standards. You're not falling apart. I mean, it's easy to forget something. To me, the standards of accreditation is like checklists for the pilots. You know, when they sit in the cabin before the flight, they all check, 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 check. Not that they don't know it as we know what to do, but it does help a lot.
Thank you very much for going over this really innovative paper. I think it really helps set the standard and help the way forward for accreditation and verify that it is important.
Thank you very much for this opportunity, and thank you for including our paper in such discussion. Thank you.